Hi, everyone. Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. The goal of this series is to explore relevant public health topics with members of our community. Today, we're joined by Taylor Guffey, SPH graduate from 2014. Taylor will present an overview of his career and share insights about his path from studying biomedical engineering to interning at the State Health Department to now serving as the manager of hospital and acute care analytics for Kaiser Permanente. Welcome, Taylor, and I will turn it over to you.
Awesome, thank you. So I'm going to go ahead and get started. All right, hello everyone. My name is Taylor Guffey, there's me. And I am an alumnus of the Georgia State School of Public Health, class of 2014, where I received my Master's of Public Health in Epidemiology. I'm very excited for the opportunity to speak with you all today. I'm going to talk about my career development after graduating and some useful pieces of information I learned along the way. Please keep in mind that this is not a peer-reviewed journal and these opinions are my own. So when preparing for this presentation, I kept coming back to this popular TV commercial. For those who haven't seen it before, it's for an insurance company where this man describes all of these crazy reasons why they've covered insurance claims in the past. He keeps saying, we know a thing or two because we've seen a thing or two. So I took this company's slogan and I applied it to this presentation because I think it sums up my feelings pretty well. I think I can be a good resource and share some valuable tips because I've seen and experienced a thing or two in the last 7 years. These include, but are not limited to, 2 presidential elections, 3 different jobs, countless interviews, and a few global health crises scattered along the way. So if we were to visualize my public health career trajectory as a timeline, I think the best place to start would be in the spring of 2011. I was a sophomore at Georgia Tech where I was working on my bachelor's in biomedical engineering. If you can place yourself in the spring of 2011, you can remember that The Walking Dead and zombie culture in general was at its peak. Like many of you in the audience today, I began my undergrad with the intention of going to med school. I liked the idea of medicine because I was always a huge science nerd and they made a lot of money, so it seemed like a logical choice. Plus, I watched way too many episodes of House and Grey's Anatomy. Many of my biomedical engineering classmates were also pre-med, so there was even more pressure to pursue the pre-medical designation. However, I felt I was going into medicine blindly with no clear idea of what type of specialty I wanted to practice or how I was even going to get into med school. Side note, engineering GPAs do not generally impress med school admissions. During one of my introductory biomedical engineering classes, we were tasked with solving 3 unique and open-ended scenarios that a typical biomedical engineer could face in their careers. As mentioned before, this was during the height of The Walking Dead and the zombie craze, and the world had just gotten through one of our generation's very first global pandemics. So I don't know if you remember swine 09, but I remember this picture of President Obama getting his swine flu vaccine circulating around for a while. In this class, one of the problems, and I kid you not, was to model how a zombie outbreak originating from a lab leak at the CDC in Atlanta would affect the entire world. Go. I can assuredly say that this is the most influential and informative class I've ever taken. We used SIR modeling, differential equations, and our knowledge of human biology to take a set of parameters and assumptions and predict the number of people affected by this fake virus. I was immediately in love. Later in the semester, I watched the movie Contagion, which if you haven't watched this movie and need a quick summary, Gwyneth Paltrow eats some bad pork in Hong Kong and ends up destroying the world. Kate Winslet is an EIS officer at the CDC and ends up saving humanity. I knew that I wanted to do whatever Kate Winslet did and use some of the tools I just learned to do it. I finished up my undergrad in August 2013. And the last 2 years of my undergrad, I knew that an MPH was my goal. So I did all the necessary work to be admitted. I knew that I wanted to be Kate Winslet when I grew up. 2 weeks after finishing undergrad, I started grad school at Georgia State. My first taste of epidemiology was with Dr. Okeson, and I still think of his lectures today. Also during that same semester, and unknown to most of the Western world at the time, a new global health crisis was forming in Western Africa. I wanted to study infectious diseases like I did in undergrad. Thankfully, global pork chop pandemics are rare, so I figured that studying HIV or STD transmission would suffice until the next big global threat. I was extremely eager and began volunteering at AID Atlanta. There, I helped with their outreach efforts, some data management tasks, and helped some of their caseworkers connect patients to care around the community. I didn't know it at the time, but this experience would be monumental in getting my practicum placement in the HIV Surveillance Division at the Georgia Department of Public Health. Before my practicum began, I was enrolled in my biostatistics class while simultaneously beginning a graduate research position. These two experiences, in addition to Dr. Okeson's classes, illuminated the paradigm shift that public health has experienced in the 20th century. Public health has shifted its focus from infectious disease to chronic disease and its behavioral or social determinants. I knew that if I wanted to be successful in public health, I should learn some of the tools that epidemiologists are using in this new paradigm shift. I was fortunate enough to be able to work with my practicum advisors and use some tools like SAS and multi-level modeling to use in my thesis. My thesis looked at behavioral determinants of HIV testing in Georgia, blending infectious disease, social determinants of health, chronic disease, and data analysis. In September 2014, just a few weeks before I defended my thesis, the first case of Ebola virus disease was found in a US traveler from West Africa. It couldn't have been better timing for a newly minted MPH grad. State health departments and the federal government were ramping up their capacity to keep Ebola virus disease outside of our borders. Because of my work in my practicum and the connections I made in the acute epi division at the state health department, I was referred by my practicum coordinator to interview for the epidemiologist role responsible for monitoring travelers coming back to the United States from West Africa. I had finally started my first big boy job in January 2015, and it was working for a state health department during an actual pandemic. I was very excited to say the least. In this role, I was responsible for monitoring the health of roughly 100 travelers each day who had just arrived back to Georgia from West Africa. Immediately, we realized we couldn't monitor this many individuals manually, so I was able to help create a user interface where travelers could log in with a username and password and enter their health information electronically. This allowed for a lot of data to be gathered over the year that I was there. Up to that point, I had a pretty good working knowledge of SAS, but I was never able to use it to its full advantage. I began automating tasks like report distributions, creating databases to run analyses on, and even helping generate some abstracts that we presented at conferences, all using SAS. I will say that 90% of this process was a matter of Googling and trial and error. Perhaps the coolest thing to come out of this was co-authoring an MMWR article about our electronic Ebola monitoring system. Due to the waning number of cases and therefore decreased attention from the government and a lapse in funding for my position, I began a new job search. I had always heard that LinkedIn was a good place to highlight your skills, but I didn't know its potential until I started this job hunt. Once I refined my LinkedIn and updated my SAS and Excel skills, I had several recruiters reach out to me with very little effort on my end. One of these LinkedIn opportunities landed me at the CDC as a health data analyst working in the Division of Healthcare Quality Promotion. My working knowledge of SAS and updated LinkedIn profile was monumental in starting work here. At the CDC, I specifically helped collect and analyze bloodstream infection data from over 6,000 hemodialysis facilities across the country into the National Healthcare Safety Network. I helped prepare data for journal articles, abstracts, and ad hoc reports for our stakeholders. I thought that I had finally reached the pinnacle of any public healther's trajectory. I was sitting in the metaphorical public health ivory tower. I quickly realized, however, that this career path was not exactly what I had in mind. There were organizational constructs that I thought were limiting my potential. I tried to expand some of my analysis skills and present them to my division, but was met with a lot of pushback. Much like I did with SAS, I tried new analyses and visualizations using R and Tableau. I saw that we were behind the curve when it came to cutting edge analyses and exploring new methods of visualizing data. In addition to a few other pain points, I decided to start the job hunt again, but this time I was going to pivot and market myself as a data scientist instead of strictly a data analyst or epidemiologist. In July 2019, through the magic of LinkedIn yet again, I was able to find a job posting and speak with a recruiter at Kaiser Permanente of Georgia. 6 weeks later, in July 2019, I began at my current employer as a hospital and acute care analyst. This position requires many of the skills I taught myself, such as SAS, Tableau, and R, but there were several other things in the job listing I didn't have experience with. I had never worked with an electronic medical record like Epic. Additionally, I knew some basic SQL syntax, but I had never worked in a SQL Server environment. Needless to say, the learning curve was steep. Despite my ignorance of EMRs and SQL databases, I was able to convince the hiring manager that learning new tools was easy for me, especially when I explained my process of learning new skills. I've enjoyed working at Kaiser Permanente for over 2 years now, and I get to create some pretty fascinating operational dashboards while providing insight to our physician leaders, all while ensuring quality care to our 300,000 members in Georgia. The COVID-19 pandemic began just 6 months after I started this role, and like pandemics of past, has actually shaped and molded my skill set and expertise. Where many other industries had massive layoffs, health and public health industries surged. To this day, we still have a shortage of skilled workers due to the increased focus that COVID-19 has brought to our organization. As you can see, I've had several different roles in different industries and settings. I thought it would be useful to compare and contrast them a little and provide more insight to those who may be torn between one or the other. First, I wanted to compare the public or governmental setting and then the private setting. So public settings, like the Georgia Department of Public Health and the CDC, are naturally aligned with the public health mission and what a typical MPH student envisions as their career. There are many interesting and exciting opportunities in these settings, and they're located literally all over the world. However, careers in public or governmental arenas are the ones often dependent on funding from the government, which all depend on a nation's public health priorities and the state of its economy in general. Also, the work was slow and too bureaucratic for my liking. If we look at private industries like Kaiser Permanente, there's typically more access to funds, which typically means higher salaries and more varied career trajectories and growth. If you're a public health purist, then the private industry may not be the best route because public health priorities often take lower priority than operational and financial objectives the company may have. Next, if we look at just the public setting, you can even compare federal and state level careers. At the state health department, you really are a jack of all trades. And often your public health work will span several subject matter areas. For example, I had a colleague who was the state expert in about 20 different reportable diseases. This data is also great for seeing your efforts cause change at a local level. This does come with lower salaries and more funding constraints in general. Also, promotions can be rare, and it's very hard to make vertical moves over lateral moves in these organizations. At the CDC, the jobs are more disease specific, and it's possible for you to become a national subject matter expert in your particular disease or disparity. Typically, the federal government has higher salaries and a larger funding stream. Additionally, promotions and vertical moves are more abundant here. Unfortunately, these jobs are much farther removed from the people you're hoping to help in your work. And as evidenced by the COVID-19 pandemic, there was a lot more public scrutiny from the general population at the CDC. Finally, we should compare the different job roles themselves, epidemiologists versus health data scientists. As an epidemiologist, your main role is to identify causality for health problems at the population level. This inherently means that academia, writing journal articles, health promotion, and education are all equally important. However, I notice that sometimes the data that you use is sparse or just plain missing, which means that you have to design studies to capture the data that you need, which has its own set of headaches. As mentioned before, epidemiologists use a standard set of analysis techniques to do their work. They get the job done, but with the advent of faster processing power, there are more advanced and elegant techniques that should be explored. As a data scientist, you have the ability to use some of these advanced techniques like machine learning and artificial intelligence. Data scientists can work in fast-paced environments where they're tasked with answering many non-traditional questions. And also, this job description is extremely sought after right now. Unfortunately, to public health aficionados like ourselves, data scientists sometimes have to answer operational or business questions that may not have a public health focus. Also, if writing journal articles is your thing, you may not like this role too much. So I don't think it's fair to show my career path as this simple line. If I were to be completely accurate, I think it would look more like this. Some of my colleagues and other data analysts' paths may have looked like this. Some people's timelines probably look like this, which in all honesty isn't the worst, especially if they could use that roadblock as a learning moment and rebrand themselves. Their trajectory could easily end up looking like this. So here's some valuable lessons gathered along the way, which I hope can be useful to most of you. One, you should always pursue what your gut tells you, not what your friends or society tells you to. If I didn't give up the idea of being a physician and embrace the idea of being Kate Winslet, I wouldn't be speaking to you today. I cannot underestimate the importance of this one. There is no opportunity that is too small. Often those are the places you'll meet your biggest allies and greatest mentors. I can trace my entire timeline back to that first volunteer opportunity I took at Aid Atlanta. If I didn't blindly volunteer with them, I would have never met Dr. Kelly, who offered me my practicum and referred me to my first epidemiologist position, which then gave me the experience to apply to the CDC, which burnt me out enough to rebrand myself as a data scientist. 3, also take your opportunities and absolutely run with it. If you see an area for process improvement, or you uncovered a new insight that can affect your population's health, by all means take that and make it your pet project. Become an expert and always improve your skill set. Don't live within the confines of your job description. Also, you should always know your own worth. If you are being underutilized or know that you should be making more money or you've been completely burnt out by your job, you have to speak up. If that doesn't result in change, you need to seek a position where you are valued, respected, and where you can flourish and look forward to starting your workday every day. Finally, a strong work ethic and passion for your job will speak for itself. Those in positions of leadership notice you, despite how small you may feel in your role. Always give 100% to anything you put your name on. A few more pointers to consider. Public health jobs don't always have the words public health in the title. Start your job search with a keyword or a software you would typically use and start your search from there. Try not to pay too much attention to the actual job title and focus on the job description instead. We have an amazingly diverse and sought after set of skills. We blend health science, math, behavioral science, and business acumen and bundle them into one degree. Tons of companies wish to have a workforce this multifaceted. Our careers, unfortunately, rely on public health crises. It is common practice in our world society to be reactionary to public health events. This often means that pandemics are the impetus of public health funding. This can depend even more on the administration in charge. I would take advantage of the COVID-19 money that has been supplied to our economy and the jobs that have been created because of it. It's an excellent time to get your foot into the door. And most importantly, always remember that your first job search will be your hardest. Getting your foot into the door of public health for the first time takes a lot of work and effort. But once you're in, it's actually a small interconnected world. Use your networking skills and the rest of your career path will guide itself. Thank you all so much for listening today. And I'm looking forward to seeing everyone's timelines begin to unfold. And I will take any questions that you all may have.
Thank you, Taylor. That was so awesome. It was wonderful to see everything sort of plotted out like that and hear the reasons for the different moves and pivots. That's just so interesting. Thank you for your candor and for sharing all of that. I have a couple of questions that I thought of as you were speaking that I would love to ask, and then I would just encourage folks that are in attendance to either put your questions in the chat or the Q&A. I'll go back and forth between those and ask Taylor any of your questions. So I was curious, when you talked about your experience at the State Health Department and you mentioned kind of being able to explore some different things and kind of be creative and be flexible. Why do you think you had that freedom at the State Health Department and then that sort of different experience when you were at CDC? What can you talk a little bit more about that?
Yeah, I guess I think it involves when I mentioned at the state, people are kind of juggling very different and multiple tasks. And because of that, they kind of let you create your own work schedule. And they completely, entrusted me to just get the job done, whatever means necessary, just, do your job well. Whereas at the CDC, everyone's a little more focused and has the ability to have more structure, so they I guess they know more of your day-to-day, which does allow for some micromanagement, I would say. So I would just say that the different work environments allowed me to really explore and stepping out and developing new processes for automation at the state versus at the federal level, which I will say I also did it at the federal level too, but whenever I would have the extra time or bandwidth to do so.
Mm-hmm. Yeah, and it sounds like that's similar to like some of our other students' experience doing their practicum or applied practice experience at the State Health Department or the local departments where, unfortunately, understaffed and underfunded folks already have their plates pretty full. And so if someone comes along with some some interest and some enthusiasm, you can really kind of run with it and develop some new skills that then make you more competitive for those other positions. I'm curious how you talked a little bit about learning new, like learning SQL, like learning new formats, I'm blanking on the word, in positions that you got. And I'm curious if you can talk a little bit about how you may have handled talking about that in an interview or in your cover letter. Like if that was part of the requirements for the position that you didn't have, how did you go about that? How'd you go about that?
Yeah. So for my most current position, they, under, desired qualifications, they wanted you to have experience with an electronic health record or an EMR like Epic. And I didn't have that type of experience because all of my work had always been, at a government. We weren't patient facing. So one, I didn't, lie in my resume or interview. I was very upfront about it, saying I don't have experience with this. But the important key to selling yourself in those interviews is always draw comparisons to what you have done. So I said, no, I haven't worked with EMRs, but I have worked with very large data sets. And then I used the National Healthcare Safety Network as an example. I said, no, I haven't, necessarily queried using SQL syntax from this EMR, but I do use SAS to do it, using these different data sets. And then I talked about how I learn a new skill. And I told them in the interview, what I do is if I know how to comfortably do it in one tool like SAS, using, 2 monitors or something, I will perform the query in SAS and then try to replicate it in SQL. And then that's how I learn. Or, if it's not SQL, you do it in R. And then just explaining that process and letting the interviewers know that you have like a game plan on how to expedite that learning curve. Usually that will be just as sufficient than having 10 years of experience in that. They're really looking for someone who's passionate about this stuff versus someone who's been bored and doing it for 20 years.
Right, exactly. Yeah, that makes a lot of sense. So I have one other question for you before I flip over to some of the Q&A that's coming in. And this might be a hard question to answer, but as I'm thinking about your journey and the types of things that you've learned and the different company cultures and environments that you've been working in, do you think you needed to take that path, or do you think that each of those situations sort of gave you more insight to what your values are for the kind of work culture that you want to be in? Or do you think you could have gone from point A to point E versus those steps along the way?
Yeah, I think that if I went any other different timeline, I actually wouldn't be in my current position. I think each one, the lessons learned is what directed that next path. And, one different, say that Ebola never left, I may still be at the state health department doing, groundwork or field work. And, if it wasn't for the feeling of being underutilized or wanting to pivot because I saw an opportunity at the CDC, I would have never, learned Tableau or start, computer programming using SQL and stuff. So yeah, I do believe that starting the public health route and learning those values and learning which pieces of public health and epidemiology I really liked were very important to build the current role that I have now. And I do keep a lot of those values of public health with me in my current role. People when they hear Kaiser Permanente, they usually think of like the insurance side, but Kaiser Permanente, is one of the oldest managed care organizations in the country. Everything is in-house. So the insurance side is also the physicians and the clinical care team. And I actually, didn't want to work on the financial side because that's not where my values are. My values are still very much rooted in, population health and understanding disparities. So that's the type of work that I try to incorporate today. Uh, some of the requests that I get may be operational type questions, but I still bring it back to the patient, because even if we're trying to, let's say, optimize physician schedules, that boils down to quality patient care. Because if you can have better physicians scheduled and use of their time, that's less money being used, and that ends up, ultimately affecting the patient. So if I didn't have that trajectory through the different public health organizations, I wouldn't have that mindset that I do now.
Yeah, well, that makes sense. So I'm going to go to the audience questions, and this is kind of related to that previous question, but what would you say were some of the skills that you developed before branding yourself as a data scientist as opposed to an analyst?
That's a good question. And a lot of it is just a matter of semantics. Those two terms are thrown out interchangeably. I think MPH grads do, especially epidemiologists and biostatisticians, have an advantage and can pivot themselves as data scientists, because we have pretty extensive statistical training as well. And that's where, a run-of-the-mill data analyst, I say, differs in a data scientist. A data analyst can query stuff and make a nice report, but a data scientist is going to find the p-value associated with it and make sure that they answer the right questions and remove human biases. And we're trained to do that as MPH graduates. So I think that's why I went with the data science route, because I did have that training, and I wanted the hiring managers to know I offer more than just data analysis. There's a statistical piece behind it.
Okay. And so, sort of related, another person was curious if you had advice for getting experience in the health informatics networks like SAS. Did you get any certifications? Do you think that that's necessary or more competitive?
Yeah. I started with, like I said, I needed to really have a working knowledge of it. And that's where all of that Googling and trial and error and on the job learning of SAS was the best for me. It's one thing to work with a dummy data set, but if you can apply it to actual data that you're familiar with and you use every day, it's just going to stick a lot easier. So after, doing that for a year and, getting that grasp on it, that's when I started for the certifications. Now, I'll say that certifications, some employers look at them, some really don't care. I actually enjoyed the certifications because of the studying portion that occurs before the certification, because you don't want to take a test and spend that money and then fail it. So it was actually a great learning opportunity just to get certified, because I was, studying for 2 months before, and I learned even more things. I don't know if that answers the question. I mean, yeah, certifications are great I don't think they're required. I don't think they would make you stand out that much more, but it's more of a personal goal, I feel like. So that's why I still get the certifications.
Yeah, and it sounds like I'm not, if the person who asked the question is still in school, any opportunities that you have to, volunteer for a faculty member or do an internship, you can do an internship that's not necessarily your applied practice experience. You can volunteer at organizations that have data and use data for their programs. So those are other things that you could do to try to get some more experience. I have another question here about you mentioned LinkedIn a couple of times and being able to really leverage that resource. Can you share how you use LinkedIn to connect with recruiters?
I know that whenever I would, do these pivots or start the job hunting, and I had, found some job postings that kind of fit, where I wanted to go, I would look at some of the, like the buzzwords that I saw in them, especially under like software skills or things like that. And I made sure that those were my, um, like top 3 skills or endorsements displayed. And then I would also make sure that those phrases in the job description, I copied some of them into my bio or like previous work experience, because basically these recruiters often they go in blindly and they'll just type in SAS or Excel, and then the LinkedIn algorithm will spit out the people based on what you put in there. So if you want to pivot and you found some job descriptions and they're very it looks like most of them require or mention Python, I would put Python as your #1 skill in your LinkedIn, and then talk as many times as possible of your Python experience in your, I guess, your resume portion.
Mm-hmm. Okay, thank you. Another question that we have is whether you have any advice or can speak about your experience applying to graduate school. So I guess going back to before you decided to go to public health, and how did you start looking and applying? If you want to talk a little bit about that process for you.
Yeah, I, once, I didn't mention, some of that process in detail. It did involve, Googling, what is an EIS officer? Like what do their careers look like? And then that's when I learned, what an MPH and what the field of epidemiology was, because, you're really not taught what that is in high school. So once I had an idea of what epidemiology was and what they do, that's when I started, my Excel sheet of different schools and programs, and my personal limitations on or algorithm of choosing them. Once I had that kind of master copy, I applied to like the top 3. I picked Georgia State, and then got in. I also met, and this was probably a little aggressive on my end, but I think it worked, is I just emailed Dr. Okeson before the application was due. And I said, hey, I'm a senior at Georgia, or a junior at Georgia Tech. I'm interested in epidemiology. I want to apply to Georgia State, but I really just want to talk to someone who is an epidemiologist. And he was more than happy to meet with me, and he kind of talked about the program and what your 2 years would look like. And I think that was beneficial because all the professors in some capacity sit on the admissions team at these schools. So just having that little plug, I think, was very helpful, and just getting that insight that only a faculty member could give.
Yeah, I love that advice. And if anyone ever has a conversation with me, then you know I'm big on informational interviewing. So what if it's for graduate school or for jobs, you think you want to work at CDC, we'll have a conversation with somebody who works there and find out, you know, what are the advantages and disadvantages, and try to get some insider information. And I would definitely encourage folks that are affiliated with the School of Public Health that are on this call. We do have a LinkedIn group that's just for our students and alumni. So if you are looking for folks to connect with in public health and maybe do some informational interviews, that's a great place to start. I don't think we have any more questions, but I'll pause for just a moment to see if there are any more. Like I said, this has just been so helpful, Taylor. Thank you. It's been really interesting to hear about your career path. And since there aren't any more questions, I will just thank you again, Taylor, and thank you to our attendees for joining us for the Currents of Public Health webinar today. Please save the date for our next webinar on Monday, September 20th at 2 p.m. for the 2021 John R. Lutzker Lecture featuring Dr. Michael Lindsay, Executive Director of McSilver Institute for Poverty, Policy, and Research at New York University. His topic will be Suffering in Silence, Identifying Suicidal Behavior in Black Youth and Creating a Research, Policy, and Practice Agenda. In closing, the School of Public Health at Georgia State is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctorate of Public Health. The faculty and students conduct cutting-edge research on the complex 21st century public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, their residents, and community-based organizations committed to health equity. If you would like more information about our programs or how to support the work of the school and our student, please visit publichealth.gsu.edu. Thank you all for attending, and please join us for our next webinar.